believe that you're here for a cranial nerve exam today. Yeah, cool. My name is Dr. Irene and I'm going to be performing it. So I'm just going to go through a couple of questions, and if you can answer them to the best of your knowledge, that would be really helpful. Yeah, cool. I've just got a assessment sheet here just to get details on like your name, your age, your date of birth, all that kind of stuff. Is that okay? Yeah, perfect. So could I get your name? And can you spell your last name for me, please? Perfect. And your age? Okay. And your date of birth? Oh, that makes you a Virgo. Cool. Could I get your address, please? Yeah. And is that like an apartment or? Okay, cool. And your next of kin? And what's the relationship between you and the next of kin? Is it it's your sister? Okay. Do you mind if I ask? Do you have a significant other? You don't? Okay. It's just for this assessment. Could I have the phone number of your sister and her name, please? Yeah. Yeah, okay. Perfect. And do you have any siblings? Two. A brother and sister. Oh, okay. It's like myself. Now, could I get your phone number, please? Three four. Okay. So 4434486621. Yeah. Do you have any allergies that you know of? No. Any food allergies? Any adverse reactions to any medication that you've taken in the past? You got a rash. What was that from? Augmentin. Okay. Perfect. I'm just gonna pop that down. Now, I'm just gonna get you to pop over into the bed. Yeah, no problem, just over there. And just take off your shoes and hop up onto the bed, and then I'll be with you in a moment. Okay? Great. Okay, for this first assessment, I'm going to be testing your sense of smell. That's okay? Yeah? So, what I'm going to get you to do is put one finger on your right nostril. Yeah, close it completely. Okay? Let's just make sure that that's, yeah, closed. Perfect. Now, through your left nostril, I'm going to get you to smell a substance, and then you need to tell me what you think it is. Is that okay? Yeah, great. I'll hold it up to your nose now. Yeah, it's coffee. Just so you can see. It's actually one of those like cappuccino sachets. It's, us poor doctors. Now on the opposite side, I'm going to get you to block the other nostril. Yeah, perfect. Just like that. Yeah, perfect. I'm going to hold up another substance and you need to tell me what you think it is. Is that alright? Yeah. It's lemon. That's That's great. Perfect. So, that's great. So the reason you came into us is because I think you've been having headaches, is it? And are these ongoing headaches? They come and go, okay. Do you get, is your sight affected with these headaches? No. Okay, do you feel nauseous? Sometimes, okay. And do the headaches come on when you're asleep? Sometimes, okay. So annoying when your sleep is affected from things like that. Okay. Now, we're going to move on to your sight. And for this, I'm going to get you to look at this board behind me. And I'm going to point to a line. And you're going to tell me which letters you can see. Now, I don't want you to guess the letters. You need to be certain, okay? So, can you tell me the letters on this line here? Mm-hmm. Mm-hmm. Yeah, perfect. Okay, I'm going to get you to cover one eye. Yep, that one's fine. Cover your eye completely so that there's no light or anything getting in. Perfect. And I'm going to get you to read this line here. Yeah. Yeah. Yeah, perfect. Now, if you want to switch over to the other eye, yeah, and completely block out the light and everything out of that. Perfect. And I'm going to get you to look at this line here. Mm-hmm. Yeah. That's great. So you've never worn glasses or anything? You've never had problems with your eyes? No? Okay, perfect. That's great. Now, I'm going to just check your field of vision by holding up my two fingers here. And I'm going to move them outwards. And when they go out of sight, you need to tell me, okay? So I'm going to slowly go out. Now keep your eyes looking straight towards me. Focus on my nose if you want to. Yeah? Okay. We're going to start now, okay? Just make sure that you focus here. Okay, perfect. And now I'm going to do the same but upwards and downwards, okay? So do the same thing. Focus on my nose here. Perfect. That's great. Now, the next test I'm going to do is going to be another one with your field of vision. So I'm going to get my two fingers again. Bring them out to that point where you said you couldn't see anymore. I'm going to get you to focus on my nose again. And you need to tell me which finger is wiggling. Okay? Yeah? So, as you're looking towards me, not if it's my right or left, how you can see it. So, if it's this one, it's going to be your right. And if it's this one, it's going to be your left. Okay? Perfect. Yep, your left. Yeah, you're right. Yep, left again. left again. Left again. That's great. Okay, now the next test I'm going to do is I'm going to shine a pen torch in your eyes, okay? This is it here. So what I want you to do is put your hand here, just like that. Yeah. Yeah, perfect. Just like this. What I want you to do is look straight forward at me, and I'm just going to shine the torch in, so you can blink as normal, that's fine. Is that okay? Yeah, great. Okay, look straight towards me. That's great. Perfect. Great. So with that, we just saw that your pupils are equal and reactive to light, so everything's good. Now I'm just going to check your pupil. I'm just going to look right into your eye. So if you look forward, like if you look into my eyes, that's okay. Perfect. Just going to move a little bit closer if that's okay. That's great. Perfect. Now, do you take pain relief when you have the headaches? You do, okay. And what would you usually take? Ibuprofen. Okay, and would you take that regular, or would you just take it to get rid of the headache and then wait until another headache comes? You take it regularly. Okay. How long have you been taking that for? Okay. It would. I know, obviously, you're the one experiencing the headaches, but it wouldn't really be recommended to be on ibuprofen for that long, just in terms of developing stomach ulcers or bleeding or anything. Do you have a history of any heart disease or strokes, heart attacks, anything like that in your family? You don't? Okay. I think we're going to just run a set of bloods on you anyway, just to be certain, and then we can take a look at other pain relief just while we're waiting on the other results to come back, like your CT scan and everything. Is that okay? Yeah? Okay. Do you experience any double vision? Like, or, how would I describe it? Like a aura in your vision? No, you've never experienced double vision. Even when you have the headaches? You don't? Okay, that's great. Now, just going to do another little test here. I'm going to just use my thermometer. It's got a blunt end, so I'm just going to place that on your face, and I'm going to assess for your reactions, if that's okay. Yeah, okay. Okay, and on the other side. And you're the only person in your family who experiences headaches? Yeah, okay. Now, next what I want you to do is look me straight forward in the face. Okay? Clench your teeth. Yeah, a little bit tighter. Perfect. Now what I'm going to do is I'm going to try and push your cheeks. Yeah, just like that. And I'm going to assess how the muscles in your cheeks work. Yeah, okay. Just do that now. Did you feel any pain or anything there? You didn't? Okay, perfect. Now, what I want you to do is crease your eyebrows like this. A little bit more. Can you do it like this? Yeah, perfect. Now, frown like that. Bring your eyebrows down a little bit more. Yeah, perfect. Now, can you just do that for me one more time? That's fine, that's perfect. Okay. Now, can you clench your teeth together like this? And I'm going to hold onto your cheeks like this, and you have to try and close your mouth. Yep. You try and close your mouth now. Okay. Can you do that again? Yeah. A little bit. Yeah. Perfect. Great. Now, I'm going to have a look inside your mouth with my pen torch, if that's okay. And I'm going to use my tongue depressor. Okay. Now, can you say ah? Yeah, say it again. And again. Perfect. Yeah. Great. Put this back in here. Now I'm going to place my hands on your shoulders. And if you could try and shrug up for me against resistance, that would be great. Okay, can you do that again? And again? Yeah, great. And then just lift up your left shoulder. Yeah, perfect. I'm going to place both of my hands on either side of your face, and I want you to try and turn your head from side to side. This is basically just checking the strength of your sternocleidomastoid and your trapezius muscles, which are at the top here. Yeah. Have you ever had any issues with your neck muscles? Any neck pain? Anything like that? No? Okay. Okay. If you try and turn to your right. Okay. And your left. That's great. Perfect. stick your tongue out for me. Yeah, as far as you can. Great. Okay, you can pop that back in and can use that for me again. That's great. Perfect. Okay, so in terms of that exam, everything seems to be in tip-top shape. Like, you've passed all of the tests for the... Yeah. So, I mean, we're going to get some bloods done, get to the root of these headaches. We're waiting on the CT results. Yeah, and they should be back like later on today, so if you want to go and grab some lunch or something like that. Yeah. Okay. Yeah. Well, I mean, continue taking the pain relief at the moment that you're taking, and when you come back to see me later on, we can talk about what plan of action we're going to do. Is that alright? Yeah? Okay. Have you any plans for the rest of the day? You're just gonna head home and rest? Yeah. Look at you. So it was very nice to meet you, and I'll see you later on in my office. Say about 3 o'clock. The results should be back at that time. Is that okay? Yeah. Perfect. Okay. I'll see you then.